Possible cautions and contraindication. Okay, a lot of patients, especially they come in after they had a heart attack, generally will be taking a combination of many drugs. It seems like the current standard after heart attack or maybe after an insertion of a stent is to prescribe a combination of an anti-coagulant or antiplatelet. So it could be Plavix or Coumadin, and in conjunction with aspirin, in conjunction with a beta blocker, and also a statin drug. Okay, so that seems to be the combination of drugs that shows the best results, and that's most likely what the patient is taking. So if the patient is on any type of anticoagulant or antiplatelet, then generally speaking, you don't want to prescribe Danson type of herb. And the reason is because Danson is also an anticoagulant, antiplatelet herb by nature. And if you combine herb and drug or similar effect together, then at a very minimum, they will have an additive effect. And sometimes it will be synergistic or multiplying type of effect. And if that happens, then in this case, you would have higher risk of bleeding and bruising. All right. So that really is excessive risk that is really not needed. All right. So if the patient comes in like that and they are already taking the drugs, all right, if they are tolerating it fine, just let it be. Okay. If at a later time they decided to gradually get off the drugs, then obviously they have to talk to their doctor about what's appropriate. But personally, I think one or two of the first drugs they can consider getting off safely probably is the statin drugs, and then maybe after that the beta blockers. All right, and the reason is because statin drug really has a lot of side effects. They really have a lot of side effects, and they are nowhere as beneficial as people think they are. And I'll show some of the data a little bit later. Okay, so if they are having any kind of problem with their liver, with their muscle aches and pain, with their kidney, perhaps that's one of the first drugs they can get off. And the second one is beta blocker, and the reason is because beta blockers also have a lot of side effects. They significantly slow down the body's metabolism. All right, so the patient is now going to be much more tired. They have no energy. They may gain weight. They may have depression, and so on and so forth. And obviously, if you slow down their metabolism and they gain weight, well, now you have to deal with even more problem. All right, so I think those are two that if the patient do want to consider eventually getting off the drug, those are the two they can get off first. Then after that, maybe aspirin or Plavix. But then that's going to be much more tricky because if they do get off those drugs, what if sometime later they have a blood clot? Okay, so the consequence of the drug not working will be much more significant. All right, so I wouldn't go as far as ever telling the patient to get off the Plavix or Coumadin and then take the herbs, because if something does go wrong, even if you have a 99.9% success rate, okay, that 0.1% could end up with heart attack, and the consequence is too great. All right, so this is one area where you don't want to, ever get into that conversation of using the herbs to replace a drug like Plavix or Coumadin.